Who would have known that long before you were a plant-based advocate, you were an expert in viruses, and you spent time in some of these wards and witnessed all of this. You've seemed to whip a book out from almost nowhere, and I wondered, maybe you can talk us through what you see that's happened in the past few months when it comes to the virus from your perspective. You know, we've been talking about it almost nonstop for 9 weeks, sometimes being censored, sometimes not. But tell me, this is the last thing I expected.
Yeah, well, certainly not the last thing I expected. I've been expecting this for decades, shouting from the rooftops along with my fellow public health professionals. Yeah, the next pandemic is always a matter of when, not if. It's just when it's going to happen, how bad it's going to be. And we're actually looking at quite a mild pandemic compared to how it certainly could be in the future. But, you know, unfortunately, people weren't ready to listen. So before I had my career in lifestyle medicine, I was in infectious disease, public health director at HSUS in Washington, D.C., and on the front lines, and wrote a book back in 2006 on pandemic preparedness and prevention. I told people, get that toilet paper. It's all in the way back when. But no one was willing to listen. And so then I defaulted, all right, fine. Well, from 1919 to 2019, every single year for the last 100 years, the number one killer here in the States, heart disease. And so I'll move on that. All I'm interested in is saving lives, but always in the back of my mind, realizing that in 1918, that wasn't a leading killer because then it was pandemic flu, just as 2020 will have a different leading causes of death as well. And so this gave me the opportunity, as disappointing as it was, to stop my How Not to Diet tour, which I was so honored to be here on London Real for. Only got to about 50 out of the 200 cities I was going to. So was grounded, but that gave me an opportunity to go back and bring all this research that I had done previously and to finally be able to kind of flex my intellectual muscle in that space. And so glad to have the book out. It's already out on audiobook, on ebook, How to Survive a Pandemic, and will be out in physical copies, both in the US and the UK in August.
Wow, that's fantastic. And I know you dedicate the book, I believe, to the Chinese doctor who was one of the kind of maybe whistleblowers, if you would, who kind of publicly blogged about this. I don't know if that was back in December or January. I'm sure you can walk me through the timeline. But when did you yourself notice something was amiss? When did you say, uh-oh, this is the thing that I've been thinking about for, say, 20 years?
Yeah, so I dedicate the book to Dr. Lee, who on December 30th was among the first to alert his colleagues about what appeared to be this first few cases of SARS pneumonia, the first deadly coronavirus outbreak of this century. But he was summoned by the Public Security Bureau, reprimanded for spreading rumors and making false statements that disturbed the public order. And sadly, 39 days later, after becoming infected with the very virus he was warning people about, he was dead at age 33. And by that time, the disease had already spread to dozens of countries. And had they not silenced the whistleblower, and in fact alerted the world earlier, we would not be facing the deadliest pandemic really in a century. But again, as pandemics go, the CDC, the U.S. Centers for Disease Control, has a pandemic severity index similar to the hurricane severity index, categories 1 through 5. So COVID-19 is shaping up to be a category 2 pandemic with a case fatality rate under 0.5%. And so there's a lot. So this may just be kind of a dress rehearsal for an even greater pandemic threat coming for the future, which is what the bulk actually of my book is about, what we can do to prevent the emergence of even deadlier outbreaks in the future. But for me, anyone in the infectious disease space is on a listserv called ProMed, which has every human, animal, or plant disease outbreak anywhere in the world And so every morning you see what new viruses and other pathogens are bubbling up around the world. And so we could see this very early on, but you never know. Is this just going to be another SARS, another MERS, another deadly coronavirus that can be squashed effectively? Because unlike influenza, you only became contagious after showing symptoms. That's a disease you can squash. You can do fever monitoring in airports, and they were able to crush SARS, only about 8,000 cases, around 800 deaths. And similarly with MERS, this Middle East respiratory syndrome. But little did we know that we could have a deadly human coronavirus where people could become infected and infectious before showing symptoms. So you can, days after becoming exposed to the virus, you could look perfectly fine, feel perfectly fine, but maybe exhaling virus with every breath. And without massive testing, you don't know who's infected, who's not, because you can be infectious without showing symptoms. So that's where these social distancing measures came from, because you just got to keep everybody away from everybody else since you don't know who exactly is infected. But in terms of personally, it really wasn't until early March where I canceled all my dates. And at that time, people were really upset, wondering why, they had booked these venues for months in advance or even a year in advance. And here I was canceling for some crazy thing that was only over in China. But I just kept telling them, you wait, give me a week. You'll see this was the right decision. And indeed, that was not the time to be traveling around internationally. But
well, you mentioned that.
Then it was a matter of just, all right, I got a book to write. Let's hunker down and do it.
How long did it take you to write the book?
This is all hands on deck kind of situation. So I just, at this point, I now have this research team, this massive research team, which I could just, turn the ship from looking at chronic disease and move it into the infectious disease realm. It's the same kind of research skills. And so in a matter of 6 weeks, we have this book, which comes out to be about 600 pages, 3,500 citations, and we're able to churn it out. And the only way we could do that is because I already had I already published extensively in the peer-reviewed scientific literature on these diseases. It's really just a matter of taking my science writing and converting it into kind of lay public, something that people could understand. And of course, doing all the research on the new virus, which took up about 3 chapters. And so, but I felt this is the time we could use this opportunity as kind of a fire drill to wake us out of our complacency, kind of a dry run for the very real disease threats that could be coming down the pipe.